Yeah, so how many planning to take ENT? ആരെങ്കിലും തീരുമാനിച്ചു കഴിഞ്ഞു? Yeah, it's okay. Yeah, so this is the usual, nobody may have already planned, but at least some of you would have decided on surgical branch, right? At least ആ ഒരു decision മനസ്സിലുണ്ടാവും, surgical branch എന്നുള്ള. Yeah, so at once upon a time, when you go back in time of history of medicine, surgery, everything came under surgery. പിന്നെ eye and ENT became separate. അങ്ങനെ പതുക്കെ പിന്നെ eye ophthalmology became separate. But ENT has stayed together, ear, nose, throat, for many reasons, for medical or basic sciences reasons. There are even some centers now, it's still called as eye and ENT centers. So ENT, I was like, after he told me to speak, so I was just thinking the main points to highlight എന്തൊക്കെയാണ് പറഞ്ഞത്. So, of course, it's a surgical branch, so those who are surgically inclined, that is definitely an option. But the one fascinating thing about surgery in ENT is that it encompasses a wide spectrum of surgery. So when you say surgery, what do you think of? I went early for lunch, so when I was leaving, I think General Surgeon was speaking at that time, and I heard him very passionately speaking about that emergency, the thrill and the blood and the gore and all those things that attracts people to general surgery, abdominal surgery, whatever. So that is one aspect of general surgery, right? So when you say ENT, it also means ENT and head and neck surgery. So commonly that is the term used, ENT and head and neck surgery. So head and neck surgery, you get all that aspect of general surgery, where you have to do, especially if malignancy, that's a proper spectrum of general surgery, where you have to really have long hours of surgery and blood and gore and reconstruction, etc. That's one spectrum. As you go to the ear, it's more of microsurgery. It becomes microscopic, microsurgery. Otology is more of microsurgery. And it's really fascinating. As you go more and more inside, it's smaller and smaller structures. You're dealing with literally things that are millimeters in size. So that is another spectrum. And then there is nose, which is more and more of endoscopic surgery. It's an entire new thing that's coming up now. Endoscopic surgery. So it's endoscopic on the screen ganda cheena surgery. That's a different skill set altogether. So my point is, ENT is one surgical branch which gives a multiple level of challenges of surgical skill itself. So that is one the thrill or the challenge of being an ENT surgeon. At the same time now, I'm working in Amrita, and even in general when we go to conferences, it's an easily observable fact that it's more and more females are joining the specialty. There have been times or postings where I would be the only male in the department. He'd be aware there are many times that all my colleague faculties and all the PGs, ellam females. So sometimes we like to keep track of our alumni. So of course it so happens that females are on board. I don't want to be genderist or politically incorrect or anything, but it so happens that due to certain factors you may not be able to be into a full surgical specialty. So there lies the beauty of ENT, that you can also very well be a sort of ENT physician sort of. ENT is basically MS ENT, but you can very easily, very comfortably practice an entire spectrum of ENT. There are a lot of diseases in ENT which can be managed medically. Okay? So only thing, of course, you should know when to refer correctly to the higher center. So that is basically the attraction of ENT, that it's a happy mixture of medical and surgical specialty. And in surgical specialty, it's a really challenging mixture of various types of surgery. If you remember your old textbooks, textbook of ENT, the actual name, Dingra's book of otolaryngology. So where is rhino? So that was how it was. So 20, 30, 40 years back, nose was a neglected thing. That's why all those old books you will see, otolaryngology is material. Because the challenging time those days were ear. The ear was a big thing 50 years back in ENT. Everything was about surgery means otology in ENT. Then laryngology got improved. Now my subspecialty interest is voice and laryngology. Okay. So adile kore karyanga. Laryngology itself now, there is voice, swallowing, airway. So that has become 3. So now it's, as Dr. Rashmi was saying, it's no longer super, it's subspecialty. So it's now subspecialty. And what has really boomed in ENT is actually rhinology. So that whole thing of otolaryngology പറയുന്നതിനെ പറ്റി തെറ്റാണ്. ഇപ്പോൾ ആക്ച്വലി മാറ്റിയിട്ട് ENT book of rhinology എന്ന് പറയുന്നതായിരിക്കും more ശരി, because it is the biggest in demand. Why is it? Because of the development of endoscopic surgery. So endoscope കൊണ്ട് പലതും ഇപ്പോൾ ചെയ്യുന്നുണ്ട്. And പലതെന്ന് പറയുമ്പോൾ it is really പലതും. So if you all remember your anatomy, pituitary tumors, pituitary tumor, it lies behind the spine. So pandaka it was a purely neurosurgical thing. So neurosurgeon would make a big incision, go brain dissection, and it is a huge morbid surgery. But now with endoscopes and with good understanding of anatomy, it is all done endoscopically. So we means the ENT surgeon goes through the nose, dissects up to the pituitary tumor, sphenoid, via sphenoid. Then the neurosurgeon comes and excises, and then we close. So that's called as endoscopic skull-based surgery. So rhinology itself now is branching into the routine endoscopic sinus surgery, endoscopic skull-based surgery. അങ്ങനെ അതന്നെ പിന്നെ further പോയിക്കൊണ്ടിരിക്കുകയാണ്. There are many places where surgeons who do fantastic amount of tumor removals, etc. via the endoscope itself. So that's the extent of things, how things have changed in ENT, especially in the nose, rhinology. So that is a big thing. So you would have many places where the surgeon would be purely an otologist, and especially in the West, it's more and more like that. An otologist would be concentrated only on otology. A rhinologist would be concentrating only on rhinology. There would be a pediatric ENT, that's another entity itself, pediatric ENT surgeon. Why is it so big nowadays? Because, any idea why is pediatric ENT so big? What is the one special thing in pediatric ENT? In pediatric otology, to be more specific? Cochlear implant, right? So cochlear implant surgery is a big thing. So that's a thing on its own. So that's how ENT goes. So here it's a otology. If you divide, you can further go subdivisions. Nose, you can go further. So it's really challenging. And then when you say challenging, it of course it then means all the other things that comes with challenges. So it can be more hard work needing thing, more of course more payment. And then there comes a downside. I am working in Kochi, in Ernakulam, Satyavastha parayam. ഭയങ്കര ബുദ്ധിമുട്ടാണ് ജോലി കിട്ടാൻ. ENT പുതിയ ഭാഷ പറയും എല്ലാവരും, I don't know if it's the right word to say, Tintin നടക്കാന്ന് പറഞ്ഞാൽ it sounds too crude to say something, but people are really, so that is the one difficulty now. So at least in Kochi is really saturated. So that is the one issue. You have to keep that also in mind. So job opportunities, I'm talking of course, my experience I'm talking of Kochi, because we have our PGs who pass out and then keep trying to contact us. It's really difficult. So ENT that way is really saturated. So that's one thing you have to keep in mind. But otherwise in general opportunities are many. So you could do any of these things. You could do a subspecialty, you could do fellowships. There are many places which offer fellowships in otology, fellowships in rhinology. You could go abroad and do certain things and then practice in any level of hospitals. It can be your own clinic, your just a small hospital where you can do the basic surgery, or then you go to the tertiary, or people like me who have more interest in teaching and research. So that's why I chose to be in Amrita. So I am interested in UG and PG teaching, interested in research, got publications, etc. And also, as you're saying, I'm also part of medical education. So all that is the other attractions, but you also get the research part. So a lot of research also can be done. So these are all the things there in ENT. So anybody who's surgically inclined or even otherwise, ENT is definitely a good option.